Hi, my name's Mike Edwards and I'm the Service Delivery Director for the New South Wales Rural Doctors Network, RDN. I have the pleasure of introducing Elisa, who is the Outreach Project Officer responsible for the Murrumbidgee, Southern New South Wales and Illawarra regions, as well as the ACT for outreach services. Elisa will be presenting on the administration reporting refresher for the program. Thank you, Elisa.
Good afternoon, everyone, and thanks for checking out my presentation. I'm really excited to be presenting on what's probably unfairly known as a boring topic, reporting. And my aim over the next 20 minutes is to show you why reporting is actually awesome and how it ultimately translates into better outcomes for your organisation and patients accessing outreach. Probably the most interesting takeaways from my presentation will be those tips and tricks that I get to towards the end. So make sure that you stay tuned until then. For those of you who don't know me, my name is Elisa D'Ambra, and I'm the Outreach Project Officer for Murrumbidgee, Southern New South Wales and Illawarra regions, as well as the ACT. Most of you would be in regular contact with myself or another project officer within the outreach team about reporting. There are 5 of us project officers and we cover all of New South Wales. Then for those of you who are not so familiar with reporting, in a nutshell, every single location of service, that is, every time an outreach clinician sees a patient, this is recorded in HOAP. HOAP is the RDN portal, and from now on, I'll just be referring to it as HOAP. So you can see here a visual representation of the thousands of occasions of service achieved across the state over one financial year. Not only is the location of the visit recorded, but the status of the patient being new or follow-up, if a patient identifies as Aboriginal or Torres Strait Islander, the number of patients that did not attend, and for some programs, even more detailed information is collected, such as the patient's age, their pre-existing conditions, their referral pathways. So for the clinicians in the room, the outreach team really do see the impact of every time you see the patients because we're constantly receiving and reviewing this data. Now that everyone knows what reporting is, I'd really like to thank all of the people here at the conference and those who can't make it for your continuous reporting and effort in giving us the data that you do. The visit and expense data that you provide has contributed to activity work plans, the RDN annual report, reports to the Australian Department of Health, RDN board reports, applications for underspend, rollover and temporary expansions. And that's just in the last 12 months. So all of these documents really do culminate to us achieving the RDN vision, healthy Australians, no matter where they live. And while we have employed all of your reporting and expense data to achieve all of this, it has not been without difficulty. Much of the outreach team's time and effort around reporting is consumed chasing up incomplete data or correcting inaccuracies between visit and expense data. So I wanted to take this opportunity to share a short video demonstrating why accuracy of the data provided by each and every outreach occasion of service is really important, and then go on to show you how you can ensure you're reporting accurately.
Accurate and timely reporting of clinic data and expenses for each individual outreach occasion of service is essential. With occasions of service per financial year averaging approximately 200,000, the data you are reporting culminates into a large data set which the outreach team uses to understand statewide program activity. So, if every time you're entering visit and expense data, you are selecting the correct location, recording visit schedules and cancellations, making sure visits and expenses balance out, and following all the useful tips I'm going to share today, the outreach team will know precisely what you have achieved in the past, and therefore more accurately be able to predict what will be achieved in the future. When we can make accurate predictions about future service provision and financial trends, we can protect future allocations of service funds and reallocate funds that would otherwise go underspent. This is the kind of risk management which allows us to temporarily expand existing services and run short-term projects such as chronic disease prevention initiatives and cooking classes. Ultimately, accurate and timely reporting translates into benefits for your organisation and your patients.
So, how can you make sure that you're reporting accurately? I'm going to now take you on a tour of the key areas of HOAP, showing you exactly how to provide the most accurate and timely data to us. And before even opening HOAP, my first tip is to use Chrome if possible. HOAP is supported by all web browsers. However, its functionality is best suited to Chrome. So if you can use Chrome, that will work best for you. Now, here we are in the HOAP dashboard. This puts you in the driver's seat. Here, you can explore an overview of your organisation's program allocations, expenses, and cash flows. And further down, it's represented graphically. Everything under this line is program specific. So you can switch between programs by selecting up in the budget square, and then everything down in the visual graph and further down will change based on the program. As you can see, if you do scroll down on the dashboard, your program services will be listed, including details of planned, scheduled and conducted visits, as well as your budget performance year to date. And here you can actually click on each individual service and you can take a look at the practitioner team. And there's also a really useful box here, the comment box. If you wanted to share something about this service overall, explain why certain things are happening, then this is a really good place to do it. As a rule of thumb, at the end of every quarter, if your conducted visits for a service don't match what was planned for that service for that quarter, or if there's a discrepancy between the visits reported and the expected expenses for those visits, your regional project officer will likely have to contact you to find an explanation for this. So if you're able to preempt this, then just fill the explanation in the comment box here and we won't have to chase you up. Finally, in this screen, there's also a click button to click and view the budget. And here you can view the individual budget for each service down to the detail of budget items such as travel, absence from practice and backfilling. So if you needed more detail about the budget of an individual service, that's where you would find it. Now, back to the list view. It's also useful to see that you can look at the income section when you scroll down on the dashboard. And here you're able to see more detail as well about what each payment actually relates to. And it's also useful to see that back in the list view, there is a list of scheduled payments. And if they have been paid, they appear as these ones have as kind of invoice numbers. And those invoice numbers are really good to quote back to the RDN team if you wanted more information about a certain payment. This is the number you could quote. And also, so you know, if they were scheduled payments and they hadn't been paid yet, here it would appear as a scheduled payment rather than a list of numbers. So, like I said before, the dashboard provides a really high-level overview of your visit and financial performance. And next, I'll take you to the ribbon at the top of the HOAP dashboard. Here you can access the visit screen, the expenses screen, and the health professional detail. Using each of these functionalities to their full potential really improves the accuracy of reporting. So now I'm going to take you into detail in each of these screens. Firstly, the visit screen. Now, before even recording a visit that's been conducted, you are actually able to record scheduled visits. And this is really a useful tool for planning and for information purposes for the outreach team, for us knowing your intended schedule for the year. For services that are occurring weekly or fortnightly, it's probably too cumbersome to record scheduled services. But it certainly is simple and useful for those services who are conducting visits maybe quarterly or less frequently to put the scheduled visits in HOAP, just so the outreach team know what the plans are for the financial year. Now, when you're actually recording the patient data for a visit, I've highlighted some useful places to show us really useful information. Firstly, there's this telehealth indicator, which is just a small video image. You can click on that. That's all you have to do, click on it, and that indicates that the visit was conducted via telehealth. There's also an individual comment section there with the speech bubble, and there you can provide a comment for a specific visit if you had a really good news story maybe about a patient in that visit, or if there was something odd such as a high number of failed to attend or a very low number of patients. You could input information here in the comment about that, and your project officer would really appreciate that you do that. Further to these details, there's also the location detail, which is really important. If you click on the pencil here, you can see the full location address of the visit conducted. It's really important to check that that is correct, and you can also edit it here in the same screen if it has changed. So this screen here is displaying the visit detail required for MOICDP visits. For other programs, such as HEBL, EESS and VOS, extra patient details are actually required, such as patient's age or referral pathways. So I won't go into detail about them, but it's really important that outreach clinicians are aware of the patient detail required and that they are collecting this information. So you'll see, for example, a VOS visit requires patient referral details and diseases identified, and a HEBL visit also requires patient ages. So key reminders here in the visit area are that accuracy is really important. So please take time to check details such as location and telehealth delivery, and that it's imperative that visits are recorded each period by the due date. The due date is always the 15th of the month subsequent to the end of the reporting period. So now, along with visits, it's also imperative that expenses are recorded by the due date. And ideally, expenses should be recorded concurrently with visits. However, this might not be possible, and later on I'll go into a checking mechanism where we can make sure the visits and expenses do work. But firstly, I'll talk in more detail about the expense screen. So there are three key things to remember. Firstly, that the invoice date should match the date of the corresponding conducted visit. The expenses recorded for each visit should be closely mirroring the per visit expectations. And last of all, if there's a significant difference between these two things, a comment can be required, or a comment can be provided here in the comment box to explain the discrepancy. Now, I also want to point out that we should remember the outreach program is a reimbursement program. So for all the expenses being reported, organisations are required to maintain invoices for these amounts, and should the need arise for RDN to produce these for auditors, we do need you to have them maintained in order for us to provide these. Now to the point that I was making earlier about a check-off between visits and expenses. This is the final step called sign-off, and it indicates to RDN that your organisation has finished recording visit and expense data for corresponding visits. It's located here in the visits menu, and it brings us to this screen. Now, leaving a visit unsigned indicates that the visit has been recorded, but the corresponding financial data has not. And by signing off a visit, that indicates that both the visit and financial data are finalised and both entered. So the last screen that I'm going to go into detail about is the health professional screen. It is the expectation that all outreach subcontractors record their certifications of their outreach health providers. So all outreach health providers must have valid working with children's checks, APRA registration certificates, and police checks. So subcontractors are expected to record these certifications here by clicking on the clinician's name. And here you can see the menu pops up where you simply select the certification type, include the valid dates, and provide a comment if that is necessary. So that brings me to the end of my deep dive into HOAP, and I hope that the tips that I have shared with you go a long way into making reporting easier for you. And this goes without saying, if you ever need assistance on your reporting, please do not hesitate to contact myself or your regional project officer. We are always there and ready to help with reporting. So once again, thank you so much for your time and effort with reporting. All the time you have dedicated in the past to reporting really makes our jobs possible. And I just want to give the key messages for the presentation are timeliness and accuracy of reporting are really important. If you can indicate things such as if a visit was conducted via telehealth, this is very useful. And finally, that health professionals' credentials are expected to be recorded in HOAP. So thank you for your time and enjoy the rest of the forum. Thanks.